This apartment in Atlanta, this rural barn in Tennessee, this mailbox at a UPS store. Millions of dollars in Medicare payments went to these and other locations. Why? Because of shell companies, corporations that exist only on paper, but listed these locations as medical clinics in what authorities consider to be a vast scam. We sent Reuters investigative correspondent Brian Grow to take a look at these locations, and his travels began in Tennessee.
Gainsboro, Tennessee is a rural two-traffic light town situated between Nashville and Knoxville. In this town of 962, there's a billiards hall, a couple of gift shops, a tanning salon, and a bank. In the summer of 2010, there was also a purported clinic called Gainsboro Ultimate. It allegedly charged Medicare for treating patients with an extremely rare disease called severe combined immunodeficiency disease. You may know it by its nickname, Bubble Boy disease, so called because patients must live in a sterile environment to prevent infection. But there was a problem. There are no reported cases of Bubble Boy disease in Gainsboro. As federal health investigators found out, Gainsboro Ultimate was charging Medicare for services it never delivered. Like an HHS investigator before me, I drove to Gainsboro to find the clinic. And I'm looking for Buck Branch Lane off of Free State Road.
Okay, you'll go up that road. There's a really sharp hill. You got to be careful. There's a really curve. Go up that hill, and as you go on that road, I think Buck Branch. I don't remember if it's on your right or your left, but it's got a sign that says Buck Branch Road.
I think he is. This is it.
What I found wasn't a clinic at all. It was a barn. This was supposedly the Gainsboro Ultimate Medical Clinic, which billed Medicare for some $200,000 in treatments for Bubble Boy disease. Gainsboro Ultimate billed a host of claims within a 2-month period, ultimately receiving some $50,000. In actuality, Gainsboro Ultimate was no more than a shell company, posing as a clinic to defraud Medicare and its private health insurance contractors. Think those were used on any patients? A small but brazen example of a multi-million-dollar scam spreading across the country. It looks like it's the old mailbox for the purported Medicare clinic. It's got its name on it, Gainsboro Ultimate. This is probably where the checks were arriving from Medicare and the private insurers who were contracting to make payments to clinics. It was probably right down there on the street. And the mailman just dropped them off before anybody started checking.
Probably the most extreme example that I can give you that we've seen here in the 7 states in the Southeast. It was a rural area. It was a barn.
Derek Jackson's team fights Medicare fraud across much of the Southeast for the Department of Health and Human Services.
100% fraud. The Medicare beneficiaries' IDs were compromised. Physician provider numbers were compromised. And there was absolutely no place of business. It was a barn.
On paper, Gainsboro Ultimate's patients lived here, just a few minutes up a winding road from the barn. What it is, in fact, is a fake address created by the fraud artists who were allegedly billing Medicare for hundreds of thousands of dollars in Bubble Boy treatments. It doesn't look particularly sterile, which is what you have to live in if you have Bubble Boy disease. The fraudulent location. Somebody's hunting. This type of shell company-enabled Medicare fraud scheme is called a bust-out, say investigators. It works like this. Step 1. Fraudsters file incorporation documents with the Secretary of State and pay as little as a $50 fee. States allow filers to list any name as an owner or officer. This lets fraudsters hide their involvement. Step 2. The shell company adopts a doctor's real Medicare provider number, which can be obtained by identity theft or paying kickbacks. Step 3. The shell company pretends to provide real medical care authorized by the doctor to a real beneficiary whose identity and Medicare number was stolen or purchased. Step 4. The shell company rapidly bills Medicare using real claim codes for medical services before anyone notices. Other shells may be formed to pose as a billing company, pay kickbacks, or launder the stolen money. This shell company scheme drains millions from the Medicare purse each year. In Atlanta, 4 hours from Gainsboro, investigators busted a fraud ring 2 years ago which used a slew of shell companies to pose as Medicare clinics. I tagged along with Derek Jackson to see what some of the fake clinics really were. So Derek, we're here in Midtown, heading up to this UPS store.
The Huarte gang.
Posed as a Medicare clinic, right?
That's correct.
What was the name of the Medicare clinic?
Elusive Quality. And they were very elusive.
And so it's a UPS store, but it called itself Elusive Quality LLC and pretended to be a real Medicare clinic. But what did they do? Did they take the address of the UPS store, 925B, and put that in as their legitimate address?
That's exactly what they did.
And then what did they say? They used their mailbox number as the suite number?
Correct.
Is that how the guys do it all the time?
That's how they do it.
Here's the clinic, right?
That's the clinic. This is the clinic where millions of dollars of claims were submitted.
Right in that hole.
Right in that hole.
How often do you see something like this? Is it increasingly common?
It's becoming more common.
Medicare says it's stepping up scrutiny of providers and hunting for fraudulent clinics. It says new fraud-fighting computer systems will help uncover bogus corporate entities more quickly. But a senior Medicare official acknowledges that the easy availability of U.S. shell companies with fake owners makes it hard to catch them all. That's in part because secretaries of state generally don't check the validity of corporate records, though it's a fraudulent act in most states to intentionally submit false corporate information. And no state collects data on the actual owners of companies, enabling so-called nominees to be used as stand-ins for real officers and directors. That means fraudulent clinics can hide in plain sight. Like here, 1500 Belmead Drive, Marietta, Georgia. On paper, this was Belmead Oncology. It billed tens of thousands of dollars for alleged cancer treatments. So we took the address for Belmead Oncology and dropped it into Google Earth.
Right.
And then we were able to zoom in on this particular building. To us, it was like if anybody had been looking, this was an automatic red flag. Do you guys think more of that should be being done by Medicare or by state officials?
Well, in a perfect world, that would be great. But in this time where we're doing more with less, I just don't know if it's possible to look at every single address that comes in on a Medicare application, or does the state have the resources to look at every single address that comes in on a business application?
Let's go see if we can find apartment D.
All right.
Here we go.
Right there.
Yep. Apartment D here. Doesn't really look like anybody's living here.
Doesn't look like a medical clinic either, does it?
Doesn't look like a medical clinic either. Kind of in keeping with what we've found all along the way. Barns, UPS stores, the ease of posing as a Medicare clinic using a shell
100%
company.
fraud.
Easy.
Again, on paper, you're processing, thousands of claims. You're processing thousands of Medicare applications, and it's a legitimate address. It's not a medical clinic, but it is an address.
That's all you need to form a corporate entity?
In some cases, yes. Sad, but that's all you need.
Yes, that's it. All you need to keep a Medicare fraud going sometimes is a shell company.